Many older adults in the United States experience leg swelling and accept it as a normal part of aging. They tell themselves that this is just what happens when you get older, when in reality, leg swelling, medically known as leg edema, is often the body's way of asking for attention. Leg edema does not usually become severe overnight. In most cases, it worsens slowly and quietly, encouraged by everyday habits that feel harmless, comfortable, or even sensible. These habits are rarely talked about in detail, and many people are never clearly warned about how strongly they affect circulation, fluid balance, and vein health in the aging body. Today, we are going to talk about 5 common habits that silently make leg edema worse. These are not extreme behaviors, and they are not signs that you have done something wrong. They are ordinary patterns of daily life that interact with age-related changes in the heart, veins, muscles, and kidneys. When you understand how these habits affect your body, you gain the power to reduce swelling, protect your mobility, and preserve your independence. As you listen, I invite you to think about your own routine. Notice which habits feel familiar and which ones may be quietly working against your health. And before we go any further, leave a comment sharing when your leg swelling tends to be at its worst, whether that is in the morning, afternoon, or evening. Your experience may help someone else who is listening today. Now, let's begin with the first habit, one that feels like rest, but often leads to stagnation. Habit number 5, sitting or standing still for too long. One of the most common beliefs among older adults is that slowing down and resting more is always good for the body. After decades of work, caring for family, and managing responsibilities, sitting down for long periods can feel well earned. However, when it comes to leg edema, prolonged stillness is one of the most overlooked contributors to swelling. A large U.S. population-based analysis published in PLOS One found that approximately 19% of older adults experience peripheral edema, and those individuals were significantly more likely to have lower levels of physical activity, indicating a strong association between inactivity and leg swelling. Your legs depend heavily on movement to maintain healthy circulation. The muscles in your calves act like a pump, squeezing the veins and helping blood and fluid move upward toward the heart. This process is essential because blood in the legs must travel against gravity. When you walk, shift your weight, or gently flex your ankles, this pumping mechanism stays active. When you sit or stand still for long stretches of time, the pump slows down or stops entirely. As a result, blood begins to pool in the lower legs. Pressure inside the veins increases, and fluid is pushed out into the surrounding tissues. This is why swelling often appears gradually throughout the day and becomes most noticeable in the evening. In older adults, this process is even more pronounced because aging veins tend to lose elasticity, valve function weakens, and muscle mass naturally decreases. What once caused mild puffiness can now lead to visible, uncomfortable swelling. The problem is not rest itself, but unbroken rest. Even short, gentle movement breaks can significantly improve circulation. Standing up, walking across the room, or slowly rotating the ankles for a minute or two helps reactivate the muscle pump. These small movements signal the body to move fluid out of the legs and back into circulation. Understanding this connection allows you to rest wisely rather than remain still for too long. And as we move forward, you will see how other seemingly small choices quietly influence the same process. Habit number 4, consuming more salt than you realize. When most people think about salt, they think about blood pressure. Very few connect salt intake with swollen legs. Yet for older adults, sodium plays a powerful role in fluid retention and leg edema. Salt causes the body to hold on to water. This is part of a natural balancing system. But when sodium intake is consistently high, the body retains more fluid than it needs. Blood volume increases. Pressure inside the blood vessels rises. And that pressure makes it easier for fluid to leak out of the vessels and into surrounding tissues, particularly in the lower legs, where gravity already places extra strain. Many seniors believe they eat very little salt because they do not add much at the table. Unfortunately, the majority of dietary sodium does not come from the salt shaker. It comes from processed and packaged foods, including canned soups, frozen meals, breads, crackers, deli meats, sauces, and restaurant meals. Even foods that do not taste salty can contain significant amounts of sodium. As we age, the kidneys also become less efficient at filtering excess sodium, which further increases the likelihood of fluid retention. This combination of higher intake and slower elimination makes older adults particularly sensitive to salt's effects on swelling. Reducing sodium does not mean eliminating flavor or enjoyment. Gradual changes, such as choosing lower sodium options, cooking more meals at home, and reading labels more carefully, can make a noticeable difference. Many people report that their ankle swelling decreases within a few weeks of lowering their sodium intake, even without changing medications. Salt does not just affect the heart. It directly influences how much fluid your legs are forced to carry. And this brings us to the next habit, one that feels helpful, but is often done incorrectly. Habit number 3, not elevating your legs properly. When leg swelling becomes uncomfortable, many people sit down and believe they are doing the right thing. Resting does help reduce strain, but sitting alone is often not enough to relieve edema. In fact, if your legs remain below heart level, gravity continues to pull fluid downward, even while you are resting. Proper leg elevation is one of the most effective non-medication strategies for reducing swelling, but it must be done correctly to work. Elevation helps lower pressure in the leg veins and allows pooled fluid to return to the central circulation. However, many people elevate their legs only slightly or for too short a time to make a real difference. True elevation means raising the legs above the level of the heart, not just placing them on a footstool or recliner. Supporting the entire length of the legs, from calves to heels, is also important. When done properly, for 20 to 30 minutes, once or twice a day, many people notice reduced tightness, less heaviness, and improved comfort. Leg elevation works by allowing gravity to assist circulation rather than fight against it. Over time, consistent elevation can reduce daily swelling and ease strain on the veins. This habit becomes even more effective when combined with the movement and dietary changes we discussed earlier. But even with proper elevation, other factors can interfere with circulation, especially those related to what we wear each day. Now, let's move on to habit number 2, which is surprisingly common in older adults. Habit number 2, wearing tight clothing or poorly fitted shoes. Clothing choices rarely feel like a medical issue, yet tight garments can have a surprisingly strong effect on leg swelling. Tight socks, restrictive pant legs, narrow shoes, or tight waistbands can compress blood vessels and lymphatic channels. disrupting the normal flow of fluid out of the legs. When pressure is applied unevenly, especially around the ankles or calves, it can act like a barrier. Fluid becomes trapped below the point of compression, leading to swelling that worsens as the day goes on. Older adults are more vulnerable to this effect because aging tissues are less resilient and more sensitive to pressure. Another issue is that feet often swell throughout the day. Shoes that feel comfortable in the morning may become restrictive by afternoon. This constant pressure can further limit circulation and increase discomfort. Choosing loose-fitting clothing and properly sized shoes, particularly later in the day, helps prevent unnecessary restriction. In some cases, doctors recommend medical-grade compression stockings, which are designed to apply graduated pressure in a controlled and therapeutic way. These are very different from tight socks or ill-fitting garments and should only be used under medical guidance. Clothing should support circulation, not silently work against it. And finally, we arrive at the most important habit of all. Habit number 1, ignoring persistent or worsening swelling. The most dangerous habit related to leg edema is assuming it is harmless and choosing to ignore it. Many older adults believe swelling is simply part of getting older and not worth mentioning. In reality, leg edema is not a disease itself, but a signal that something in the body needs attention. Persistent swelling can be associated with conditions involving the heart, veins, kidneys, liver, or lymphatic system. In some cases, swelling in one leg, sudden swelling, or swelling accompanied by shortness of breath or chest discomfort may indicate a serious medical issue that requires immediate evaluation. Ignoring these signs delays diagnosis and often leads to more complicated treatment later. Early evaluation, on the other hand, frequently allows for simpler interventions, better symptom control, and improved quality of life. Paying attention to your body does not mean becoming anxious. It means recognizing patterns, noticing changes, and communicating them clearly to a healthcare provider. When swelling is addressed early, it is often much easier to manage. Leg edema should never be dismissed as something you must simply live with. It is information your body is giving you, and listening to it can make a profound difference. Leg edema often worsens not because of one dramatic event, but because of daily habits that quietly encourage fluid to remain in the legs. Sitting or standing still for too long, consuming more salt than you realize, failing to elevate the legs properly, wearing restrictive clothing, and ignoring persistent swelling all contribute to this process. The encouraging truth is that many of these habits can be changed. Gentle movement, mindful eating, proper rest, supportive clothing choices, and early medical attention work together to reduce swelling and protect circulation. Taking care of your legs means taking care of your freedom to move, your comfort, and your ability to enjoy daily life. Eating balanced meals, staying active in a safe and consistent way, and paying attention to how your body responds are essential parts of healthy aging. As we close, I invite you to share your experience in the comments. Which habit resonated with you the most? Have you found something that helped your leg swelling? Your insight may help someone else who is listening today. Take care of your body. Stay connected to what it is telling you. And remember that protecting your health allows you to fully enjoy the years ahead.